Hello class, my name is Brenda Velasquez and today I will be talking to you guys about brain damage and the ability of the brain to rework itself with support of neuroplasticity. So my first research article was to showcase the effects of undergoing sets of neuropsychological rehabilitation programs to improve those neglect tasks. This study was focusing on a patient that was experiencing visual spatial neglect after experiencing a right hemispheric stroke. In this case, it is a tendency to ignore the left side of the body or left side of objects. And in his case, it was relating to the visual perception of the spatial relationships of objects. So if you look over to the lower left, we go ahead and have an image that is a really good example of that. They have the model, which is what the image that they were provided, and then you have the patient's drawings, which if you look closely, they completely ignored the left side of those images. And then they went ahead and used functional magnetic resonance imaging, also known as fMRIs, to measure the blood flow involved with brain activity. So this resulted in, if you look over to the upper right, you can go ahead and see those results before and after a 14-week rehabilitation program, and this resulted in increased activity in both the left hemisphere and preserved areas of the affected hemisphere. And something interesting that I learned from this in the course was that we had talked about brain plasticity and how the repetition of those lost abilities of the brain can reorganize and slightly fulfill those voids. And obviously using the fMRI, we can go ahead and showcase that. Next, we have my article number 2, which was to showcase the reorganization and recovery of the brain. So neuroplasticity varied on patients of different ages who had suffered impairments after acquired brain injury, mainly children and adolescents. So correlate of consciousness resides in the prefrontal cortex. As we learned in class, it is key to reasoning, problem solving, comprehension, impulse control, perseverance, and creativity. So in this study, they used sleep wave activity and EEGs to record their memory, independence, and track their improvements. If you look to the upper right, we go ahead and have that image that shows those memory improvements and trackings or records. And it resulted in memory improvements of the posterior partial cortex, and memory was also improved after stimulation. Now, in my article number 3, we talk a little bit more to showcase patients who have suffered traumatic brain injury and their experiences. So this was sample based on factors such as gender, age, inclusivity, location, and their experience with care. They were interviewed over the phone by 13 experienced interviewers, and they were asked open-ended questions regarding factors that could impact their rehabilitation journey. Results such as having a support network, staying optimistic and engaged, and getting good care resulted in positive improvements and good progress. A case that stuck to me was the Gabby Gifford case, and it just showed me that when things are encouraged and practiced, it is great for brain recovery and rehabilitation, and in her case, she was able to regain her speech. Last but not least, I have my last article, which was to showcase that vitamin D is an unrecognizable global epidemic. Vitamin D treatments can be beneficial and can relieve disease severity in acute ischemic stroke patients. In this case, it was murine patients, which is relating to affecting mice or rodents, and they used middle cerebral artery occlusions, and it was used to remove the temporal muscle ligate the common and carotid arteries, block the middle cerebral artery with monofilament, and then they restored the blood flow an hour later by removing that monofilament, and it resulted in the experimented group showing positive results. Both the mRNA and the protein levels of the vitamin D receptors showed a significant increase in the ischemic hemispheres, and then the brain reorganization after stroke, vitamin D receptors had a positive impact of the brain. And this reminded me that the brain is able to slowly recover from brain injuries such as strokes by reorganizing and provide a positive impact. Thank you guys so much. These are my references.